When someone says, oh, my patient has kyphosis, what does that mean? Well, to me, it's a little bit, it means there's an osis with the kyphotic curve. There's a problem with it. So you could assume that always means there's too much curve, but I prefer when someone says, now I'm not diagnosing, but I want to have someone clarify. They have the appearance of hyperkyphosis or hypokyphosis. So hyperkyphosis is too much of a curve. So if their kyphotic curve in the back is too much, you can have facet on facet, bone on bone. They step off a curve wrong, and they're already bent, like they step off, and there's a possible damage to the joint. But the idea, the reason we have a spring for a back, we have this lordotic curves, and we have the kyphotic curve, is to allow us to have a nice spring, right? And so when you have too much, that it puts too much stress in the back. That's why in scoliotic curves, they want to put Harrington rods in to protect from too much and having it go awry. In hypokyphosis, a lack of curve is also just as dangerous. If I have hypokyphosis, that's too little curve, or almost a straight stick for a spine. And why is that bad? Well, if I have a straight stick for a spine, I step off a curve, excuse the fat jiggling you're going to see, but I step off and there's this impact, it's going to damage the joint. It puts too much pressure on the discs. And so I want to keep that curve, not too much, not too little. And so that's where chiropractors and massage therapists work together in tandem, is to bring health to that, keep the curve balanced, keep the curve in its natural state where it should be, and to bring it back to that point. So too much curve isn't good because you might have bone on bone and some other downsides, as well as too little curve, which causes too much wear and tear on the structure itself. A lot of folks give chiropractors a bad time for just like, well, all they do is just crunch my back, crunch, crunch, crunch. And again, I said before is that, you know, lack of movement is death. And chiropractors are dealing with spines that are not moving well enough, and there's a fixation, there's this lack of movement, you're likely to have more issues build up in there. And so they're just crunching down the back is better than none. You know, some are very specific in how they work, but in general, movement is good. And same is true with massage. If we just use an elbow up the spine, up the erector spinae, it's very, very, very beneficial. And just by taking 5 or 6 passes in your normal, you know, massage that you're doing, just by 5 or 6 passes on a spine that's tight, the person's just stressed out, is going to help those multiple muscles in that group to start to let go. Most importantly, what often gets ignored, though, is the little muscles in the ditch, the lamina groove. And by working inside that ditch with a finger reinforced and digging and opening those muscles up, those control the angles of the vertebra, and those are not to be neglected. So make sure that as you do your work, dig in the groove, get those little guys to start moving better and to give them the help that they need. But just your finger in there, small movements as you work on those makes a big difference. Archimedes said, if I had a long enough lever and a strong enough fulcrum, I could move the world. We say lever because it sounds cool, an old saying. The idea is that a lever and a fulcrum is what allows you to lift something really, really heavy. And so if your car, you know, gets a flat tire and you pull to the side of the road and you open up the trunk and someone forgot to put the jack back, go find yourself a stop sign, work its way out of the ground, don't tell the police I said this, and then roll a boulder up next to your car and then put that 4x4 piece of wood or metal under your car, come back, and then press down. So this is the lever and the rock is the fulcrum. The closer that rock to the car, the more power you have. The farther back that rock is, the more it becomes a ramp and really becomes not helpful at all. So it's like a teeter-totter. You put that fulcrum right in the middle, those equal strength. So if I want to lift up 100 pounds on this side, I have to give 100 pounds of force on this side with a center fulcrum, right? So if I want to have more strength, as I push that closer to the car, now 100 pounds gives me 200 pounds of strength. I push it even closer, now it gives me 500 pounds of strength. So as long as that fulcrum is strong enough, and so is the lever, I can lift pretty much anything. So Archimedes was basically saying I could move the world if I had a long enough lever and a strong enough fulcrum. Why am I talking about this? Well, your body has this thing called a sacrum, and all this power and all this stress comes right to that point. Before I got into massage therapy, I got out of college, I got my degree in business and marketing from Western. I moved forward and I achieved all my career goals really quick out of school. I had really dumb career goals, but I achieved them really quickly. I wanted to make more money than my dad. I wanted to have a home in Bellevue. I wanted to own, and I wanted to have a certain European luxury car. And I thought, well, that was stupid. I got on my goals really quick, and now what? So, but before I left that job that gave me those things, my goals, it was a commercial steel building company that built these warehouses for Costco and Boeing and Kenworth Truck and these big steel. Well, those steel frames that they used to support that roof have these bends in them, right, at the corners, and all that stress comes down. If you can imagine Boeing having an aircraft hangar 300 feet wide with no poles holding the roof up. And then we get a 3-foot snow, some crazy snow in the Northwest. Now it starts to rain because it warms up as it does here. And now we've got all this weight on the roof. All that weight, hundreds of pounds per square foot in some parts of the country, starts to push down on the roof. Well, where does that stress go? well, it pushes out at the corners. And that's called a moment reaction. So when you're working on the body, all that stress of the body really comes down to the sacrum, and our posture makes a difference too. If I have a wide stance, I put some more pressure on my sacrum if I pull my feet together. What's also important to realize is that injury that takes place in a car accident, a lot of injury takes place in the SI joint, and those ligaments get overstressed, and that can be helped out by a number of ways. Everything from cross-fiber friction to prolotherapy. Proliferative injections can draw that back in and tighten it up, but essentially that's a very, very important part of your mechanics of your body. What that means to you is some of you are taught in school a technique for releasing the psoas where you put your hands into the psoas and you have the person lift their leg off the table. I don't care if it's lifted up a little bit or a lot, but let me explain some dynamics of force to you. If I have a 100-pound ball of concrete and I set it on top of a stick and I hold that pole vertically, it takes a couple of pounds of strength to hold it in place. If I start to tilt that pole away from me, every time I hold it out a little bit farther, that gets heavier and heavier and heavier, and pretty soon I can't hold it in place at all. It's just too much for me. And so you have to realize that the dynamic of that weight is important. So the head, for example, let's just say my head for mathematical easiness there is 10 pounds. And if my head is perfectly postured on my neck and I'm looking like this, I've got 10 pounds of stress on my neck. As soon as I go 1 inch anterior movement, 1 inch anterior, it adds 10 pounds to that. Now I've got 20 pounds of stress on my neck. If I go 2 inches, now it's 30 pounds of stress. Every inch anterior, and pretty soon it just magnifies. So you have to realize that as we work on the body, the posture is important just to help keep the client better, but so is how you work on them on the table. And so when you're doing that kind of work and the person has a destabilized back, it's in an acute situation, low back pain, they crawled into your office practically, do not put pressure on that and have them lift their leg off the table. Once they're in the subacute phase and they're doing great, you stabilize things and they're getting better, awesome. Use all those techniques that you learned, but make sure you get them stabilized first before you start doing things that can possibly put moment reaction stress on the sacrum and really exacerbate their injury and hit the ligaments and make them just get worse and worse. You want to help them get better and better instead. So the technique we're going to show in this in the class this morning is the psoas release technique. Now, people say, what's the iliopsoas? It's like, well, yeah, those two muscles together candy cane and spin and connect to your lesser trochanter, but we're just releasing psoas. There's very few people that I would ever work on that can actually get to the iliacus and not cause damage to the tissues just getting to it. So if I can release the psoas, oftentimes the iliacus instantly lets go at the same time. It just releases. So if you're super, super, thin, you've got stretchy skin, you've got, extra weight, and just, sure, I can get to it. Most of us real people, we can't get there. I've got a few friends who are, Rolfers and Zen therapists that love to have that done. I'm not looking at anybody in particular, but as you dig into that, you can release it, but I prefer to let the psoas go first and let the rest of it cascade and settle down. So once they're out of the acute phase, you can do all the different work you want. You can cross fiber friction and trigger point and pin and stretch and stretching work, and that's awesome. When they're walking in your door and they can't even walk, they're just walking over, bent over, they're in the acute phase, just get them out of pain. Has anybody been on their back for a week and couldn't move? You've had that kind of pain? It's scary. For those of you who have not had that, imagine when you had the flu, the worst ever you've ever had, and you're laying there in your bed, you're thinking, what does it feel like to feel normal again? You forgot what that feels like. It's the same with the back. It's actually kind of scary. You think, I might never walk again. You can't imagine if it's just going out of your bed to go to the bathroom, it's exquisite, sharp shooting pains. It's scary. And so I want to get my client to a place where they can see the change. There's a psychological change in the brain when they go, there's hope. And literally, this is the fastest technique that I do that has almost instantaneous response. It's very, very quick. In a matter of moments, you work on them for just a few minutes, and they get off the pain, and you've dropped their pain by 50, 60, 90, 100%. They're like, oh my gosh. And this is a really fast technique, which brings up the philosophy of filling the hour. When you work for an employer that says, okay, you need to work on every client for 50 minutes, I have a really difficult time with that ethically. It's great for money, great for income, not good for the client. They may only need to have a 10-minute technique done to them, right? And the prescription says, treat for low back, and I treat them for the first 5 minutes. It's getting better, getting great. They're out of pain. Now they're getting worse and worse and worse and worse. And I leave them lay there on the table until they're out of pain. That's not good. You want to get your clients out of pain and get them off the table and get them moving. Don't make them lay there. Movement is life. Lack of movement is death. Get the pain gone. Get them moving. Don't have them go out dancing. Now, the first thing they want to do is go out dancing and doing all the yard work they hadn't gotten done, right? No, not too much of anything. So don't overtreat this. Get them done. Get them out and move them out the door. I often tell people, how long is it going to take? I'll say, I don't know. Maybe 15, 20 minutes. My fee is this, to get your back to feel better. It's not based on time. Now, insurance companies, they're time-based. So if your doctor wants you to fill that space up, you're going to have to figure out what else to do and do this last. It's the last thing you do before you get them off the table. A couple other things to be aware of with this is that, I mentioned the 17-year-old, she tried everything else. This spasm of the psoas can kick into gear and fight against the low back muscles, and it can go on for decades. I've had people say, you get in a car wreck before? Well, yeah, it's like 15 years ago. Did you ever have this treated? No. But once you release it, boom, a huge change. So it's very fast. But it's something you can do pretty much anywhere. I was at a men's conference years ago with my dad. He invited me to come along for a weekend, and we're sitting there drinking coffee, and I don't know why men think that we are what we do. What do you do for a living, man? So we're drinking coffee, and it gets around, and the guy goes, I'm a cop, and I'm a truck driver, and it gets to me, I'm a massage therapist, and I'll go, oh. I bet I fix backs and cause a lot of pain. Oh, really? I got back pain. You drive a truck, right? So I just laid the guy on the ground, did the technique for 3 minutes. That's all it was. And he gets up and goes, oh, my God, how'd you do that? Next guy, I got back pain. I ended up working on all these men, one after the other, and they said, you got a card? No. Oops. Now I teach classes on carry your cards. But the point is, it's really, really fast. I've done it in people's homes, at parties. I've done it, I was in Rome at my bed and breakfast I was staying at here this last year, and the lady's back was killing her. Actually, first the husband was talking about carpal tunnel, and I fixed it really quick, or I shouldn't use the word fix. People get mad when I say that, but I alleviated her pain with my techniques. And she's, and she said, and she didn't speak English, her husband did. So I released that, and he said, well, she has back pain. And so I took the couch cushions, laid them right there on the floor in the middle of the entryway, and she gets up, and her back pain was gone. Just a matter of minutes. Now, if I treated her for half an hour, it wouldn't have worked. You've got to do it really quick, get the release, and get them moving again. Don't leave them there for half an hour after you get it to release. You have to get the motion, get them moving. If they were on the table, they came in for something else, mentioned they had back pain, get this done, work on it, have them wrap themselves up in their sheet toga style, step off the table, and see what it feels like before you leave the room. I want to see them see that change. It's gigantuan. It's huge for them. And as they watch that, they go, oh my gosh. And you want to be there for that moment. And then don't leave them there. So say, okay, you can go get dressed. I'll leave the room so you can get dressed now. But it's the last thing that you do. A couple other notes for you that are very, very important. And this is really important. If you work on them and you relieve the pain, and the relief lasts 2 or 3 days, all they need is you. Just massage therapy. If you do this technique, you release it typically 1, maybe 2 more treatments, and they're typically out of pain unless they go back to the perpetuating factor that may have caused this to begin with. If you treat this and the pain's relieved in the last 2 or 3 hours, there's a chiropractic component to this. Something is fixated and the muscles are responding to protect, and the problem is coming from that fixation. So you release this muscle, have them see a chiropractor within a half an hour after you're done, relieve that, and typically let's go. You got to remember there's an ego issue when it comes to chiropractors and massage therapists. So you've got to be able to work with that. I had a situation that's pretty sad. Another 17-year-old girl, daughter of somebody I went to high school with, and she called up and she said, hey, can you work on my daughter? Her back's killing her. I said, sure. So she comes in. I did the technique. She gets up. Oh, pain's gone. Great. I said, listen, 2 hours or 2 or 3 days, right? And so I said, call me back if you have any problems. So about 2 hours later, she calls me up and she says, you know what? Yeah, the pain's starting to come back. I said, great. Go ahead and call your chiropractor. Set up an appointment. My schedule's flexible. I'll go ahead and come in after, whenever it works for you. I'll work on your daughter. We'll send her right over to the chiropractor and get treated, and she should be done. Well, she comes, calls me back about 20 minutes later, and she said, I'm caught in the middle. I don't know what to do. I said, what are you talking about? She goes, well, the chiropractor said that if you treat her first, she won't work on her. I said, this is not to be boastful. I said, does your chiropractor know who I am and what I do? She goes, yeah, she knows about your school. And I said, how long has your chiropractor treated your daughter for this condition? She said, 2 years. So I said, okay, there's a bit of a concern that your chiropractor might look bad if I can do 1 treatment and she does 1 treatment and your daughter's done, because that would mean all this time she's been taking your money. So I have somebody else I want you to see, and I sent her to my chiropractor buddy who taught for our school. So you need to be able to realize sometimes there's ego with this, and it's very embarrassing for a chiropractor who does not believe in massage therapy to work with you, because if you can expedite healing processes that they weren't able to. So there's no reason. There's reason for both of us. I believe fully in chiropractic, and I believe fully in massage, and they're both necessary. But you need to work together in tandem to get people better. One thing I want to say about this muscle, when you work on, people come in complain of pain typically in the quadratus lumborum, lower erector muscles in general. And they both are really usually having a problem. I don't just blame QL, but we just use QL as a way to say it. But the quadratus lumborum typically is where the pain is at. Problem is typically that you have an overbearing psoas muscle. That said, you look at the skeletal models of your skeletons and massage schools, these lower floating ribs have these really cool things called wires that hold up the floating ribs. Oddly enough, you guys weren't born with wires to hold up your floating ribs. So when you see your books and everything else, you see this huge space between the lowest floating rib and the iliac crest. In reality, people with low back pain, many of them, the QL muscle is pulling down so hard on the quadratus or on the lowest floating rib, it's touching the iliac crest. And so when we find our landmarks, we find it and we go between the lowest floating rib and the iliac crest. And when I do this demonstration, every class I teach around the country, I always have people that have some serious problems with their low back, and then we go in to palpate, and sure enough, I say, okay, here's the float, they can see it, lowest rib, and here's the iliac crest, and I can barely get 2 fingers between. So when it's pulling down and just pulling really hard on that, we've got to be able to release it to get it to go back up. But so if they say, yeah, it kind of hurts to do this, I get a pokey sensation, that's because their floating rib is actually touching the iliac crest. It's a very, very powerful muscle. So be aware of that when you're working on people for this injury. I had a woman in Minnesota who volunteered to be the model on the table, and the whole class was quietly gasped because she weighed about 400 pounds. And they're thinking, okay, really? How are you going to get to this person's psoas? Well, first of all, when you have someone that's large and they lay on their back, most of the fat starts to go laterally, so it makes it easier to get to it. So their thickness still isn't that deep, and their spine, their back fat's there too, so their spine's in the middle. It's really not going that deep to get to it. But even if I can't touch it, when I use my elbow to go into the psoas, which sounds funny, but fingertips are more painful than an elbow. If we do this right, you go in, just the intent of going in there, the fascial connections as you go through that web of tissue, when you put pressure and they breathe deeply against that, and that pressure of the breathing causes the psoas to let go. So I may not even be on it, but all the interconnected tissues with that give me the benefit, and I still get the release. So regardless of size, you're able to do that. As we've explained in the lecture, the low back release technique is very simple, very straightforward. For right low back hurts the most, we're going to begin on the left side on the QL. So we'll go ahead and have her practice this motion where she pushes her butt up in the air and then back down, low back up. And I don't use anatomical directions and those kinds of things. The patient doesn't understand those, so just explain and have her practice. Relax for a moment. Put your fingers at the top of the iliac crest and also at the lower ribs. Find the halfway point there. And we're going to work right up against the spine. So find the spinous processes. There's a ditch. Next to that is the muscle itself. And rector spinae and QL are closer than often people think. They think the QL is very, very far out. It's not as far out as you think. So we're going to grab the lip of that, put some pressure at a 45-degree angle down, hold that pressure, make sure the client can take it. If there's any sharp pain during motion, don't have them move at all. Hold our thumbs in there, thumb over thumb, horizontally, so that nice broad technique. It's not pokey and sharp at all. Put pressure. Have her begin to raise her bottom up in the air. Great, and then back down, push the low back up, there. We're not going for speed, we're just going for a duration of time, so keep that motion moving, back and forth. Have them go as hard as they can, comfortably, without causing it to be a sharp pain or beyond their abilities. Do this for about 2 minutes. Keep that pressure constant. If this feels comfortable or uncomfortable for your thumbs, go ahead and pause for a moment. We can use our elbow. To do this, make sure that the elbow is perpendicular to the back and vertical. I want to make sure the forearm is vertical, straight up in the air, limp, relaxed wrist. Put pressure down and have her continue on with that motion. As she lifts up, I lift up. Pressure forward is constant, but I allow the back to come off the table. I don't want to pin the back down. This allows the muscle to get stretched out a bit, good ischemic pressure, and prepares the back for healing. After about 2 minutes, we'll pause gently, switch sides, and repeat that again. After that, we'll switch, turn her over, which we'll do now. Go ahead and scoot down, turn on your back for me. Great. We're going to have her brace her knees for me. A little higher up. Great. And I'll go ahead and position a breast straight so the camera can see properly. Once she's into position, we'll go ahead and start on the psoas. So if we work the left QL first because that was the least painful, typically the right psoas is also going to be the least painful because they cross laterally brace. So we're going to work on same side of the table. We want to look at the ASIS and lower ribs. That's a halfway point is drawn right across here on the body. That's our midpoint. We're also going to measure from the belly button to the side. Those two intersection points is a rough guide of where we begin. Oblique angle, fingertips. We're going to drop down, exhale,
we'll drop in again. Each time she exhales, we'll drop in until we hit the actual psoas itself. To find out if it's the right spot, she'll gently lift her leg up a tiny bit. It'll engage the muscle and you'll know you're there. So nice gentle breaths. Each time she exhales, I drop in some. When she inhales again, I release the pressure, come back out, drop in a bit further each time. By about the third breath or so, you should be on the muscle. Her knees are bent to take stress off the muscle itself. Once you're there, hold that pressure, and she's gonna take a nice deep breath. You're gonna hold the pressure down and resist that pressure. Release, she'll exhale again, give her a free breath. But each time she takes a deep breath, make sure you put pressure down the muscle. Don't let it come off the back. So nice deep breath. I'll drop down again. I'll lock the muscle in, hold it, deep breath. It's going to be pretty intense, so make sure you give them a chance to breathe between each attempt at this. And do it maybe 4 or 5, maybe 6 times at most. She exhales, drop in, lock that down. Again at a 45-degree angle, deep breath, I hold additional pressure, and release. Make sure you release before she exhales. Guys, you're going to sense more of a menstrual cramp sensation. So make sure that as you push in there, that's a normal sensation for a woman. She might feel that radiating pain, and that's normal. It's going to be showing you that you're actually on the psoas. Again, 4 or 5 times, have the client get up and walk around the room and feel that change right away.